you. Thank you. I don't even know you, but thank you. Thank you.
For what? I haven't done anything.
You haven't done anything yet. You already talked to Shepard Smith and you told it straight. And that's why I came to you.
No.
I'm a parent. I'm also a professional facilitator of communication and conflict resolution. And my goal is to help co-create solutions with parents, admin, and staff together. And the reason I'm turning to you is you said these are radical times. You said these are radical statements and thoughts premising what you had said, but this is a crisis and we need to respond accordingly.
Right.
And I have the outlook that we can.
All right. No, nothing that has gotten us to this point, that has ensued to this point, would indicate that that's possible. But but you're from Santa Fe, which is I used to work on the Navajo reservation, and I ski up at Purgatory. So
so it's a home away from home for you.
Not quite, but yeah. So I would like to think, but go ahead. I didn't mean to interrupt.
No, I appreciate that you did, because you said nothing would indicate that we could, and it reminds me that I'm a hopeless optimist. So with that admitted, I hope we can do better. And one of the reasons I hope we can do better is you said it plainly. My children's life are at risk. I kept them home for 15 months. And they're going back, would you agree, in a more dangerous August than last August?
Yes.
Yeah. In an ideal world then, Doctor, would schools be looking to build their current program on the most safe practices? Kind of reversing their thought, not, okay, here's our program and we'll try to do the best thing to keep them safe. Here's what's safe. Let's make a program that keeps our kids safe.
Well, that depends on, the school system. So there's another aspect to this, which is even more sobering, that the last 18 months has been a dress rehearsal for Delta variant. And now the Delta variant is a dress rehearsal for the next virus. And so, I think people have conveniently forgotten or haven't put two and two together, in a sense that, that in many of our lifetimes, let's forget about the Spanish flu, but in many of our recent lifetimes, we started out with HIV and AIDS, and then have progressed with HIV and AIDS and SARS and MERS and H1N1, Ebola, Zika, COVID-19. So this is a continuation of a trajectory of viral infections, some of which have reached epidemic proportions, some have reached pandemic proportions, all of which have been serious. And the next variant will be the next virus, but there are hundreds of other COVID viruses out there. And so the next one will be more virulent, more contagious. The next one might affect children with more virulence than it currently is. The other part of it, which we talked a little bit about, in the 5 minutes, is that increasingly we're understanding that this is, like many viruses, this is a virus that could potentially impact children throughout their life. And so this idea that have constantly railed against, that this is a benign disease for children, is absolutely unequivocally not true. And even children who are asymptomatic, right? So kids that are asymptomatic, the multi-system inflammatory disease hits 6 weeks or so after kids who have had asymptomatic infections with COVID. And so that's a perfect example of the irrationality of making a statement that this is a benign disease for children. And so when you bring in the school system, I'd be more than happy to talk if there's a role that I could help support you in. It's true. Starting off with, we need to create a safe environment that will, in fact, support the safety demands that we have and the safety demands that parents have going into the future. So let's build an infrastructure. Nobody built, now, in the context of South Florida, maybe I shouldn't say this, but in general, nobody builds an infrastructure that to support a building or a bridge that from the start is not going to be able to support the bridge, right? Or the building. So why would we build an infrastructure for our schools that does not have the capacity to provide the environment that we know kids need in order to be safe?
I was pointing to my nose for that old adage, on the nose. We wouldn't do it in other conditions. And innovative solutions is part of my life and profession. And that's where I feel like lots of good intention thought has been lacking. So here's one of the biggest. We'll wear a mask. Everyone has to wear a mask. This was last year when they opened schools, except for when we're eating or napping.
Makes no sense. Well, if you can fly on an airplane and wear a mask, but not when you're eating, or not when you're drinking.
Right.
It's beyond ludicrous.
Right. So I needed a doctor to say that. And thank you, because when I say that, I'm getting a lot of feedback. Well, you're not an expert. And I'm thinking, but would you, if a surgeon's going to open up your belly and he didn't have a mask on, would you be, I mean, some of it's just obvious.
Right, that's exactly right. It is, what they say, it doesn't take a rocket scientist.
So if we don't remove our masks indoors for any reason, and we were to eat outside one way or another, which we can figure out in some areas, would that change our risk significantly? Would it be like apples to oranges?
Absolutely. Everybody has to be wearing the mask indoors because the masks do two things, right? They prevent you from spreading it, and then they prevent you from breathing it in. They do a better job of preventing you from spreading it than protecting you. But the two are required. So
just to tag that, it is a community effort, this mask wearing. An individual effort is not relevant here. The community needs to be wearing masks appropriately and well for this to work.
Yes. Yeah. So, that's not to say if you're in an indoor environment and you're wearing a mask and nobody else is, that you don't get some protection. But that protection is significantly less than if everybody's wearing a mask. It is clear that the 6 feet of social distancing is irrelevant because the significant spread of the disease through small droplets, which can go 25, 30 feet or more. So initially, the science was that the virus was spread on large droplets, which fall to the ground quickly. And then as more data was accumulated, it was clear that it was also spread through small droplets, and which can be spread a distance. But it doesn't seem that social distancing is a major contribution.
Well, the distancing, if we're imagining a small school, if it's closed, then 6 feet or 20 feet doesn't really matter, because whatever's in the air is going to be in the air. It's not going to just go away or fall to the ground, as you're saying.
Right. So all of these are really very simple, simple interventions. The mask, HEPA filters, keeping the windows open, social distancing as much as possible. We initially, there was a beginning of this pandemic where we were wiping down our groceries and so on. It doesn't appear as if the infection is spread significantly by surface contact. And then, mandatory vaccination.
And what's your opinion about private schools? If a private school is asking your advice, would you say mandate it for your families?
It'd take me about 7 nanoseconds to say that. Yes, absolutely. This is about people's lives. It's not about liberty and, and the statements made by whomever. Yeah, absolutely. And in particular, it's about children's lives. And nobody has the right. I do a lot of work in children's rights. And so nobody, children have a right to optimal survival and development and healthcare and on and on. Nobody has the privilege of depriving me, my child, or any children of the right to optimal survival and development. And it's a profound disrespect for children, and it just disregard for the right to optimal health. So yes, absolutely.
And the consequences that a private school might be concerned about, people pulling their kids out, legal suits and battles they don't want to get into. How would you respond to their concern about the consequences of doing that much protection of a child's right?
Well, there's no legal basis that anybody could sue. Well, they could sue, but there's no legal foundation to support a suit. People taking their kids out, that's that's the risk. That's, as you said, this is a crisis, and a crisis requires courage and leadership. And that's what we expect of people who are, in particular, people who in whom we are entrusting the lives of our kids.
I really appreciate hearing this from you, who's so forwarded children's rights, and we're living in a privileged society. I'm in contact regularly right now with my friend from 1993 in Zimbabwe, and they're not doing so well. We live in an environment where we have the privilege to buy a good mask.
It's a privilege to have the potential and the capacity to do it, but it's not a privilege to do it. It's an obligation. And it's it's an obligation based on fulfilling their human rights, and in this case their right to optimal survival and development. And in the human rights environment, so we're all duty bearers. We have adults are duty bearers, kids are rights holders, and we all have that responsibility. If people don't want to exercise that responsibility, then they need to remove themselves from
endangering
the domain, right? And if it involves children, their children, then they need to remove their children. And we just had a 16-year-old die yesterday. We've got 7 kids in our children's hospital. I'm pointing because it's right across.
Because they're right there.
In the intensive care unit, we have kids on ventilators. The number of children in our hospital has gone up 5-fold in the last week to 2 weeks compared to any point in time during the pandemic. The virus is highly contagious and highly virulent, and it's a new virus. And so I've been saying we should be talking about COVID-21, not confusing it with COVID-19.
Well, and as you said, if we're on a trajectory, these innovative ideas, which I really want to bring forward, are not just temporary. Maybe we need to get more innovative as a society to be community protective and child protective if we're on a trajectory as you predict.
Well, that's the answer is yes. We're talking about resilience and resilience plans related to climate change, right? And so this is all about building resilience into our infrastructure as it relates to our capacity to respond to infectious diseases, in this case, epidemics and pandemics. Nobody would build a building that couldn't withstand here as an example in Florida, we wouldn't build a building that couldn't withstand a hurricane force of 180 miles an hour, right? So the resilience plans for building into schools need to really be able to respond to what will happen in the future. And it's not a prediction because we've seen the past, right? The past predicts the future or defines the future. We've seen that. And there are a number of studies looking at caves in bats and caves and around in China, and just identifying hundreds of novel coronaviruses, and then looking at the antibodies in villagers around, and they've all got antibodies to these. So we know that there are coronaviruses that are new coronaviruses that are infecting people in proximity, and any one of them could mutate into one that's contagious and virulent.
So all of you're only impacting me more. All of these solutions for our schools are not just let's get to January when hopefully they can get a job. These could be important infrastructure buildings that we're going to need and could save hundreds of thousands of lives the next time if we get it done right this time. And what I'm talking about in innovation is if we admit the premise that it would be unsafe and potentially even child abuse to ask a child to take their mask off indoors right now, to say, okay, snack time, okay, nap time. If, child abuse, I know you said very confidently, but even if we say it's unfair to a child and unethical, then we have to figure out the other option. I'm curious on the outside idea. How much risk reduction do we get if they're outside and not sitting like shoulder to shoulder, but potentially even at the same table with some distance? How much risk reduction do we get?
Significant. It's very significant decrease in risk dealing with the new virus.
Yeah,
and
that's what I was going to ask.
All bets are off. All bets are off.
And if what Fauci keeps saying is accurate, that the same amount of viruses in the nasal pharynx of a vaccinated person as an unvaccinated person who's infected, and a vaccinated person could be asymptomatic with the same amount of virus in them, now that we have Delta, then outdoor spread could be more of a.
It could be more of an issue. It hasn't been defined as yet, but certainly it could be.
So is it fair to children if they were asked to take their mask off and eat outside, and unfair if they're asked to take their mask off and eat inside?
I would say that yes, it's children shouldn't be removing their masks indoors. I don't know that one could make a statement, given the Delta variant, how risky it is to be outdoors. The data would indicate that at least up till now, it's relatively safe to be outdoors, and be without a mask. Then you're weighing risks and benefits. I think it's clearly beneficial for kids to be in schools. If the risk is 1 in 10,000 or 1 in 100,000 or whatever it is to get the disease of your outdoors, then it's a matter of risk and benefits.
But you brought up a good point here, and in the interview with Shepard, that we still don't know how bad the long-term effects are. We know they're really possible, and we don't know how bad they are. So we don't even know the full risk in our risk-benefit analysis.
That would be a very, very true statement. It seems like if that it's about a 1 to 5% of kids will have prolonged illness, but that doesn't speak to those kids that have asymptomatic or unknown impact who will be affected down the line. Have polio, right? So that post-polio syndrome impacts people decades after asymptomatic cases of polio. And we have lots of post-viral syndromes I didn't mention it on the Shepard Smith show, but I gave an interview here last week. It's sort of stuck. I'm hearing it coming back is that parents wouldn't let their children swim in a toxic swamp, right? Yet every time they go into an environment in which there are people who are unmasked, it's a toxic swamp of COVID.
If you were the parent of my 5.5-year-olds, if you were sending a kid who cannot be vaccinated to school, what would be your requirements of the school? Absolutely, I'm not going unless they check.
I would demand that all the teachers and staff, anybody who's responsible for my kids' safety, be vaccinated. So I would also require that. And anybody that made a statement that in fact we can't do that, it's wrong. They can do it. Also, excuse me for a second. Also, anybody that says it's a HIPAA violation that we can't ask, that's absolutely wrong. It's not a HIPAA violation. HIPAA only relates to healthcare institutions, not non-healthcare institutions. So they can. So I would, I wouldn't be settling. I wouldn't be settling just for. I would send my kids to school if there's a mandatory mask requirement. Well, I have grandkids, and so that's my counseling to them. But I wouldn't be stopping there. I'd be working and advocating for mandatory vaccination.
So anybody eligible of the families of the school are vaccinated would be the teachers and staff. In private schools, you could say, look, I'm sorry, yeah, private.
If you want to send your kids to private school, then vaccinate. The public schools, you couldn't do that, but certainly with students you could. We do that all the time, right? You want to come to school, then you have to have these childhood vaccines.
So with private schools, that kind of protection of all families vaccinated to attend would be big and is possible.
Sure. Sure, absolutely. It depends how courageous and kind of leadership want to provide.
But that's what you said that struck me. These times take courage and leadership. And right. It does. Otherwise, we have kids' lives at risk,
Nothing less.
Nothing less. Yeah, thank you for that.